Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. If you have pain or tenderness in your jaw, or if your jaw is making a popping or clicking sound, you might have TMJ pain. It's estimated that 12% of people in the United States experience TMJ pain at some point, so it's far from rare, and you don't have to just live with the pain, and you can deserve to know what causes it. If you're ready to get relief from your TMJ pain, we've got some good news for you. Not only do chiropractic TMJ adjustments help ease pain when you visit a chiropractor, but you can also do some soft tissue work at home to help loosen up the jaw muscles and reduce TMJ pain. TMJ adjustments are quick and provide relief to pesky pain. So, what is TMJ? TMJ pain is temporomandibular joint disorder, and it's a blanket term for acute or chronic inflammation of the TMJ joint, which is what actually connects your mandible to your skull, your joint to your skull. It's a commonly used term that refers to a wide variety of conditions that affect TM joints, like jaw muscles and also the facial nerves. Your jaw joint, also known as the TM joint, exists to connect your lower jawbone to the temporal bones of your skull on each side of the head, and the muscles controlling the joints are attached to the mandible and allow the jaw to move. The TM joint works in two different ways. Its first function is to exist as a hinge to open and close your mouth, and the second function is a sliding motion called translation, where your lower jaw moves down and forward too. And this motion helps the TM joint to move backward and forward and from side to side to help you make things like chewing motions, also talking, singing, yawning, things like that. When you open your mouth, the rounded upper ends of the mandible on each side of your jaw glide along the joint socket at the base of your skull, and when you close your mouth, they slide back to their original position. When those rounded upper ends of the mandible slide back into place as you close your mouth, you may hear a pop or a click, and this is one of the hallmark sounds of TMJ. TMJ is very common, especially with younger people. The causes here include direct injury, trauma to the jaw, teeth grinding, nail biting, degenerative joint diseases like arthritis, infections, and autoimmune diseases. Approximately 12% of the U.S. population is experiencing TMJ at any particular time, and many of them don't realize that a chiropractor can help with the pain. A lot of people believe that they have to just deal with the pain, and that's really not true. A lot of our patients with TMJ actually come in for a chiropractic TMJ adjustment and experience immediate relief that improves over time. So some of the common symptoms here are ear pain, headaches, neck pain, jaw pain, soreness, jaw pain when biting or chewing, difficulty opening and closing your mouth, popping or clicking, jaw stiffness, tinnitus, dizziness, and sensitive teeth where no other dental problems can be found. So if you're experiencing any of these problems, you might have TMJ. When you visit us with jaw pain, we'll focus on three key muscles: the masseter, the temporalis, and the pterygoid muscle. We'll also pay close attention to the suboccipital muscles, the jaw joint itself, and the top two vertebrae, because they generally impact the jaw joint, and we want to make sure that everything is aligned properly. Your masseter is a thick, deep muscle in the upper jaw area that exists to allow you to chew your food. If you put your hand on your cheek and open and close your mouth, you can actually feel it. The temporalis is a thinner, clam-shaped muscle on each side of the head, and this muscle is important for chewing and covers a broader area than the masseter, including the area around your temples. In order to work on the masseter, you can place two fingers flat against your jaw, press inward with flat fingers, and then up to put pressure on your masseter, and then open and close your mouth. From there, you can move up to the next part of the masseter and continue to do a total of 3 repetitions to complete one set of this exercise. We recommend doing 3 sets of this exercise 3 times a day. The same exercise can be done to the temporalis too. When working on this, you'll want to use 4 finger pads, use the same movement and pressure you did in the masseter exercise, but remember, the temporalis will require less pressure than the masseter because it's a thinner muscle. So again, do 3 sets of this exercise in your temporalis 3 times per day for TMJ relief. So anyway, if you have these types of issues, make sure to get it checked chiropractically and get it adjusted, and we'll be able to get rid of the pain hopefully as soon as possible. Check us out at newhopechiropractic.com. You can also make an appointment there, and we'll also go over some additional exercises for you to have a healthy day.